During this briefing both in English and in Spanish today. If you'd like to listen in Spanish, select the interpretation icon at the bottom of the screen and select Spanish. Hola, bienvenidos a todos. Tenemos interpretación en español. Para escuchar en español, clic en el globo en la parte inferior de su pantalla. And we're just going to wait a moment longer while we get live on Facebook. All right, it looks like we're live on Facebook now. Welcome, my name is Kate Cole with Public Health Seattle and King County. And we're here with our health officer, Dr. Jeff Duchin. He'll be giving us an update on COVID-19, and then we'll take questions from the media. So I'll turn it over to you, Jeff.
Thanks, Kate, and thank you everyone for joining us today. This may be the last opportunity for us to chat before the holidays, so we wanted to have a chance to get together and answer your questions. I'll start with comments, give a brief update of the epidemiology, and then take your questions. So each day, more and more people in our community continue to be affected by the death or illness of a family member, loved one, friend, or colleague from COVID-19. And again, I want to send condolences from myself and our public health team to everyone who has suffered these losses, who's been impacted by the outbreak, and we wish a speedy recovery to the thousands of people who are infected each week. This has been a terribly difficult year in so many ways. With the availability of vaccines, we're all looking at the potential to begin a gradual recovery from our COVID-19 nightmare. But even with highly effective vaccines on the horizon, we're not close to out of the woods. And the COVID-19 wildfire continues to consume and disrupt too many human lives. We continue to see too many cases, hospitalizations and deaths are rising, and the threat to our healthcare system remains hazardous. For the next few months, we'll need not only to sustain, but to increase our efforts to prevent COVID-19 spread in every aspect of our lives, at home, at work, and in the community. As of this morning, there have been 56,588 cases reported, 3,808 hospitalizations, and 976 deaths in King County since the outbreak was recognized in February. Our case reports have decreased since the peak in late November and early December, but remain elevated at high levels, approximately 500 new cases reported daily over the past week, and this is compared with a peak of about 200 a day in the spring. We reported more than 19,000 new cases in November. And I just, again, want to remind everyone that reported cases are just the tip of the iceberg. Our colleagues at the Institute for Disease Modeling estimate that there are about 10,000 active cases of COVID-19 currently in King County every day. So what gets reported, diagnosed, is just a fraction of all the cases that are occurring. And I don't want people to look at our numbers and think that represents every case of COVID-19 in the community. Our 14-day incidence rate decreased slightly, but it remains above 400 per 100,000. And we're seeing a sustained increase in hospitalizations throughout November and into December, with over 200 hospitalized in the past 7 days. Over 30 people were hospitalized per day over the past week, up from around 50 people per week during the previous 6 months. The number of hospitalizations is rising in every age range, and our highest in the 40 to 69-year-old age group, followed by the over 70, and finally the 20 to 39-year-old age group. There are almost 400 confirmed and suspected COVID-19 patients hospitalized in King County. Almost 90% of our acute care and ICU beds are occupied. 12%, or over 1 in 10 of those acute care beds, are occupied with a COVID-19 case, and 20%, or 1 in 5 of our ICU beds, are occupied with COVID-19 patients. We've seen an increase in COVID-19 deaths since mid-November. The most recent week shows an average of 6 deaths compared with less than 2 deaths per day for most of the previous 6 months. So that's 6 deaths daily currently compared with less than 2 for the most of the previous 6 months. Given all the outbreak, all the community transmission that we're seeing, we're not surprisingly seeing an increasing number of outbreaks reported from all corners of the community. We saw a record number of outbreaks in November. 224 were reported. This is the highest count since the beginning of the pandemic and a 42% increase compared to October. There have been 66 outbreaks reported so far in December. Many of these are in long-term care facilities and supportive living facilities, approximately a third, and about a quarter are in non-healthcare work sites. Largest increases were within the long-term care facility setting, as well as child cares and homeless service sites. In November, we saw 64 new long-term care facility or supported living outbreaks, and that exceeded the volume observed in March. This is about 2 times the number that we saw reported in October. The number of outbreaks in child cares has more than tripled in November to 34 compared with 10 in October. We have 8 reported so far in December. And we're also seeing increasing cases among homeless and homeless service sites, with the number of sites increasing by 2-fold and cases increasing by 62% over last month. We've had 106 outbreaks in non-healthcare work sites reported in the last 6 weeks, 90 in November and 16 in December, including 38 outbreaks in manufacturing businesses, 33 in retail or hospitality work sites, and 27 in food service establishments. And as I mentioned last week, we've also seen increasing numbers of healthcare worker infections. There were 750 reported in November, which was the highest number since the outbreak began. They still represent a small proportion of the total number of cases that are being reported, however. About 1/3 of these healthcare worker cases are in nursing staff, and most of these nursing staff are infections in the long-term care facility settings. So I'd like to talk a little bit about vaccine. And as many of you know, our State Department of Health is taking the lead for enrolling healthcare providers as vaccinators statewide and allocating, distributing doses to those sites. And we work very closely with both our local healthcare system colleagues and the Department of Health to ensure the program is success in King County. We're trying to maximize our ability to direct vaccine to those providers who are in need and who are serving high-risk communities and who are themselves high-risk providers. We provide technical and logistical support to our healthcare colleagues and healthcare systems who are grappling with this new challenge and new vaccines and new systems to administer them. In the first couple of days, we did receive a small allocation of 3,900 doses to Public Health Cell in King County, and we are using that limited number of doses to vaccinate paramedics, emergency medical technicians, and others who can then be deployed to vaccinate other people in the community. And we will begin to vaccinate long-term care facility staff whose organizations don't otherwise have access to vaccine through the federal pharmacy program. We did administer our first pilot vaccination clinic yesterday with EMS providers, and it went very well. And in addition to our own staff, we have members of the Public Health Reserve Corps, CHI Franciscan, who've been running some of our COVID-19 testing sites participating, and we have other service organizations who've offered to help with vaccination efforts as we expand them. We are challenged by the relative small investment that our federal government has made in vaccine implementation planning and in the rollout of the vaccine at the state and local health levels. We've had to redeploy many public health workers who've been working on other areas of the COVID response to take care of this priority right now. And we are really running on fumes, as you know, given the 9 months solid of COVID-19 vaccine response, COVID-19 outbreak response that we've all been engaged in. And we're hoping to be able to get additional resources from the federal government imminently to help us bolster our ability to build our vaccination implementation program to a robust and very effective operation as quickly as possible. As you know, the supplies of vaccine are coming out in small amounts initially, and they will gradually increase. We've always understood that this is a long-term endeavor, talking about vaccination timelines in months, and perhaps by summer have vaccine available to anyone in the community who would like to get vaccinated. Initially, the priority groups for vaccination, in accordance with guidance from the CDC's Advisory Committee on Immunization Practices, are those frontline healthcare workers at highest risk because they care for COVID patients and suspected COVID patients, and the long-term care facility population because of their high risk for serious illness and death. And then we anticipate that following, we will be giving vaccine when it is available, or offering vaccine when it is available to our essential workers and other adults at high risk for serious COVID-19, either through advanced age or underlying health conditions. So in closing, I do want to just reiterate that although the rise in reported cases has slowed over the past 2 weeks, our situation remains truly hazardous. Our hospitals are stressed and are canceling surgeries. They're working on emergency staffing and preparing for a worsening crisis. And we continue to need to do all we can to ensure life-saving medical care remains available to all who may need it for any reason. And I want to thank everyone who is taking and continue to take the essential steps we need to take to stop the spread of COVID-19 by decreasing their activities outside of the home, limiting gatherings with others outside the home, avoiding crowded indoor spaces, wearing masks, especially during this holiday season when gathering is so much part of our tradition. The virus is not going to relent over the holidays or in the next few months, and we can't either. Please don't give anyone COVID-19 as an unintentional holiday gift. Please limit your gatherings with people outside the home. Continue to take all precautions. Pay special attention to improving indoor ventilation this winter. And please remember the significant risk of being exposed to COVID-19 during travel in the United States at this time. And for those who must travel, and for anyone exposed to someone with COVID-19, quarantine remains an important tool, so please review the CDC guidance. With that, I'm happy to take your questions.
Thanks, Jeff. We can now take questions from the media. Please use the raise your hand function and we'll call on you. First question is Simone Del Rosario. Go ahead.
Thank you, Dr. Duchin, for these reports and for always answering our questions. As we know, there's a lot of confusion about how many Pfizer doses the state's going to be getting. DOH was told yesterday that their expected allocation was cut by 40%. I'm wondering what impact you're seeing in King County, and added to that question as well, being told that you're only going to know how many doses you're getting a week in advance. How does that complicate your ability to be able to make sure you're distributing effectively?
Yeah, thanks for the question. As I mentioned, I think the thought and planning given to the vaccine rollout really was not proportional to the thought and planning that was given to the development of the vaccine, which was absolutely appropriate. we've done something that's tremendous scientifically. We've got safe and effective vaccines in record time, and we're ready to use them. However, the amount of planning, foresight, and investment in then taking those vaccines that have been developed and shown to be safe and effective and getting them into people's arms has not been adequate. And so it really is a challenge here on a number of fronts. There is the planning piece, the preparing of the vaccinators, the guidance, and this latest snafu around allocation. I do and always believe that we should anticipate delays and unanticipated challenges, snafus at every stage of this process, from vaccine production to distribution to allocation to potential safety issues that may be seen when millions of people are vaccinated, rare events. So I'm not surprised. I'm disappointed it happened so quickly, that we're already seeing challenges with respect to allocation. We didn't have enough expectation or knowledge of what to expect to make that this would be changing what we were expecting to get dramatically. But we certainly had hoped to have a steady stream. What we were told was we were going to have an ongoing increasing stream after the first allocation. And I believe, in the long term, that will be true, that we're going to see more and more doses coming into the community. But it is frustrating for those vaccinators who have signed up through the state program who have not yet been allocated vaccine, and for those who are using vaccine and planning to continue to vaccinate, that the supply may not be there next week. So only time will tell. We'll see how quickly this situation can be addressed and fixed. But at this moment, it's too soon to say what the ultimate impact will be. We need to see what the reason was and whether the subsequent allocations are going to be as expected.
Great. Next question is from Dee Dee Sun. Dee Dee, go ahead.
Sure. Just to clarify on that last question, Dr. Duchin. So are you expecting a shipment of the Pfizer vaccine next week, and how much? And so do you know if you're still going to get it?
We in public health are not expecting a shipment next week. We have received our initial shipment and we're in the process of using that. We don't know, we haven't heard from the state or the federal government what the status of future expected allocations is. And I think the state will have the most information because they're basically running the allocation system and they're in direct communication with the feds.
Got it. And then my other question after clarifying that was, the state mentioned on Sunday that they were hoping to get the Moderna vaccine shipments as early as Monday. I know that you're working closely with the Department of Health, of course. What are you expecting from, on terms of the Moderna vaccine, what are you expecting to receive next week?
Yeah, so Moderna, so there's good news. For those of you who've been following, you probably saw that yesterday the Federal Food and Drug Administration's expert independent advisory committee recommended that vaccine be authorized for use, and I anticipate that will happen any minute now by the Food and Drug Administration. It's currently, at least when we started this conference, hasn't yet been authorized. And once that happens, the CDC's advisory committee will be meeting to make recommendations on how to use that vaccine, and similar to what they did for the Pfizer vaccine. And then that vaccine will be authorized for shipment. We haven't heard yet of any definite allocations. The state had some preliminary numbers that they were expecting, but I think given the news from yesterday, it's probably best to check back with them. I have not heard that there's any change in the expected number of doses that we were going to receive of the Moderna product.
Thanks. Next question is from Evan Bush. Evan, go ahead.
Hi, Dr. Duchin. One thing I'm curious about, the Moderna and Pfizer vaccines have different storage and handling procedures, and I'm wondering if there's a strategy in King County for where these particular vaccines will go or be directed, and also if you might be able to talk a little bit about the differences between the two.
Absolutely. The Pfizer vaccine, the first to be authorized, was unusual in that it required some very stringent storage and handling capabilities. It required a deep freezer, down to minus 80 degrees centigrade, that only a few acute care facilities, hospitals, typically have on hand. And so that vaccine is not well suited for, use in the community where those freezers don't exist. It has to be stored at a very cold temperature and then used very quickly after it's thawed. And so those first shipments and subsequent shipments of Pfizer will go to facilities that have that special equipment, those special ultra cold freezers, and that's mostly hospitals. And that's why one reason why the initial strategy nationally has been to roll out vaccination to those healthcare workers in the hospital settings who have that vaccine close at hand. It's very hard to move that vaccine into the community because of the storage requirements. The Moderna vaccine, however, is more typically stored it's stored in more typically available refrigeration equipment, so general vaccines grade refrigerator. So that vaccine can be used in the community at community-based healthcare settings, like provider offices and pharmacies, much more readily. And the plan is that once Moderna vaccine starts to flow, those facilities who have signed up to be vaccinators will start receiving supplies. Excuse me. So the Moderna vaccine, our strategy, and consistent with the national strategy in the state, is that vaccine is more well suited to being used in the community at frontline community health clinics, provider offices, and so on. And that's the second phase of the distribution. So that we're very much looking forward to. We know that over 1,000 providers have signed up to administer vaccine. More are in process, and that will be the product that they will primarily be receiving.
Thanks. Now I'd like to ask a question from community via Facebook. Folks are asking, at what point do you think teachers will be able to get the vaccine?
Okay, great question. Kate, before I go there, let me just step back one more comment on the Moderna and Pfizer. Those are both mRNA vaccines, exciting new vaccines that are produced with the mRNA technology. They don't contain any virus. They can't cause an infection. The vaccine just basically provides a molecular blueprint to our bodies to make a protein that the immune system recognizes and that provides immunity against COVID-19 very, very effectively. They're both comparably effective, and the side effect profiles appear very similar. So I just wanted to let folks know that although the vaccines, the Pfizer, Moderna, go to different places, they both appear to be extremely high quality and have comparable safety profiles to the extent that we know that information at this point. With respect to teachers and others who might be wondering, who are workers in the community, the Advisory Committee on Immunization Practices this Sunday is scheduled to meet. This is the CDC's external advisory group. Makes recommendations to CDC for policy on who will be up next in the tiering after the frontline healthcare workers. And in that group are essential workers, critical infrastructure, first responders, others who've been helping us keep our community rolling, keep our food supply and other utilities and so on available to all of us. Teachers are considered to be part of that essential worker group. So when we have more information and more guidance from the CDC, the state will be providing interpretation for Washington, and we'll find out, more in more detail how that tiering will go. The frustrating part for everyone is that there's just not enough vaccine for everybody right up front. we're all going to have to be patient. And again, we're talking about vaccine rollout timeline on the scale of months. So it's going to take that long for people who want vaccine, who are in the initial groups, to get it. And we know that everyone who wants it right away won't be able to get it right away. We're frustrated, as everyone else is, that that's just not possible. But with a new pandemic vaccine and a brand new vaccine implementation system, it's very challenging to make it simultaneously available to everyone. So we're trying to provide a structured approach based on the limited quantities that we get and tiering it in accordance with the federal guidance and the local guidance that we develop.
Thanks. Next question is from Glenn Farley. Glenn, go ahead.
So some clarification here. Secretary Azar was on television this morning about this 40% shortage business for next week, saying that there has been some sort of miscommunication. It kind of reflects what the governor was saying yesterday. Hate to harp on this, but going back to some of your comments, have you not had any communication from state DOH today on this issue? And when you say you're not going to get any vaccines in this week, or this coming week, are you saying just for King County Public Health, as you illustrated earlier, or just no vaccines will be coming into King County facilities, hospitals at all?
Yeah, thanks. Important opportunity to clarify. We haven't heard any more from state about the explanation for the 40% reduction, whether that was a miscommunication or that's truly going to happen. So I'm glad that Secretary Azar feels that it was just a miscommunication, and then that would mean that the expected doses will be arriving. When I said that we're not expecting doses next week, I was referring specifically and solely to our public health department. We have the doses that we need to start our pilot programs and to begin gradually to expand our vaccination capacity. So it wasn't that doses that we were expecting were not coming. We had not requested additional doses at this point. Other healthcare facilities may or may not have requested and been allocated doses, but only DOH can tell you that right now.
Great. And next question is from T. Matassa. Go ahead. Should be able to unmute if you're ready to ask your question.
Oh, hi there. Hey, it's Tammy. Thank you. Can you hear me?
Yes, go ahead.
Okay. Hi, Dr. Duchin. Thank you so much for your time, as always, and your refreshing insight. Hospitalizations, as you mentioned, are way above the threshold of where we need to be. That 90% number seems quite concerning. Could you talk to us about the impact with that, especially with the holidays coming up and the fact that, most average Americans aren't going to have access to this vaccine for what seems like an eternity? Thank you.
Yes, it does seem like an eternity. We would love to see this outbreak brought to a very screeching halt, but we know that's not possible. Even with vaccine, we're going to have to continue to use every tool we have to fight the virus for several more months at least. The vaccine is not going to stop the pandemic in its tracks, although it will slow it, and to the extent that we can get people vaccinated and people are interested in getting vaccinated, it may slow more rapidly, which would be wonderful. The situation with the hospitals remains grave, and I'm sure you are following what's happening in other states. There are a number of issues, but the biggest one is that they're very busy. They're full with patients, taking care of all types of patients. Again, COVID is still a minority of the patients that are in the hospitals, but they're increasing. The number of COVID cases, both in the acute care beds and in the intensive care units, are increasing, and they're very complicated patients. They require a lot of staff resources, and they make it difficult for the healthcare system to care for all the other types of patients that need to be seen. So the the danger is that if we see too much COVID spread through too many gatherings in the community, through people engaging in too many activities outside the household, through people not taking precautions, through socializing. We do know that, parenthetically, there have been a number of parties, large parties, that people are continuing to have and put one another at risk. We've seen outbreaks in the context of faith-based organizations holding in-person services. There's a large number of workplace outbreaks. We know some workers are coming to work with symptoms. We all need to really look at our own activities and try and do everything we can to minimize the risk. And that would mean, decreasing the opportunities for people to meet in person when it's not essential, taking all precautions to increase ventilation and masking when it is essential. Faith-based organizations should consider pleased to worship remotely whenever possible and not put their congregations at risk from in-person activities whenever they can. And in workplaces need to be more vigilant about excluding workers who have symptoms and those who have been exposed to other workers and not letting them back in the workplace. All these things will help decrease the risk. So for people who are anxious and want vaccines soon, I understand. I'm glad people are interested in getting vaccinated. I wish we could make it available instantaneously, but we do have other effective tools at our disposal to decrease COVID transmission, decrease our risk of getting sick. The threat to the healthcare system, however, is extreme because if we don't have a lot of wiggle room where we are in the outbreak right now, even a small increase in our activities can result in a dramatic increase in the number of ill people, people who need hospitalization, and that translates into increases in deaths. And the stress on the healthcare system, they're not infinitely expandable, our healthcare system. They're not elastic. They're not like rubber bands. There's only a limited number of staff who are also very stressed, who also get sick, and who are very, very fatigued from working through 9 months of this outbreak. So the need for all of us to continue to try and suppress this virus through our own personal behaviors, our workplace policies, and our policies in social and other events, it remains essential to protect the healthcare system.
Great. For our final question, we have a question from community on Facebook. Folks are interested in knowing about spread of seasonal flu this season and how it compares to COVID.
Yes, thank you. Up until now, we've seen very little flu activity, which is a great relief because the specter of influenza complicating COVID-19 was extremely hard to manage. The Southern Hemisphere saw very little flu activity, and we've seen very little here in the States and in the Northern Hemisphere. Part of that is due to the fact that the introduction of the virus from the Southern Hemisphere was greatly reduced because they had much less disease, and part of that is due to the fact that globally people are taking steps to increase their distance, decrease their interactions with one another, and these same steps that we take to prevent COVID transmission also interrupt the transmission of other respiratory viruses like influenza. So if we continue to successfully separate ourselves from one another, our risk of having influenza spread will remain low. To the extent that we begin to gather, our risk for influenza will again rise. But at this point, I'm very happy also to see that the flu has remained at very low levels. If folks haven't gotten vaccinated, though, it's still, I think, a reasonable thing to do because we are never able to predict precisely both or either the onset or end of a flu season. Particularly this year, things are very different, complicated by the COVID virus circulation, and I don't think we can rely on what we wish to be true to protect us. So if you have an opportunity to be vaccinated and you haven't been vaccinated yet, still a good idea.
Great. Thanks, Jeff. Any final closing thoughts?
I want to just take this opportunity to thank everyone for their tremendous efforts over the past year. I particularly appreciate our colleagues in the media who have been working so closely with us and so diligently to get good information out to the public to help them make decisions to protect their health, to protect our healthcare system, and to help us recover as soon as possible. Also, again, want to thank everyone who has been through so much hardship and who are taking the steps and continuing to take the steps we need to take to turn this increasing trend and this increasing threat around so that we can get through this holiday season, through the new year, and into the coming months where we have increasing supplies of vaccine and can hopefully begin to see this virus recede. So thank you, everyone, and I hope everyone has a healthy and peaceful holiday season and new year.
Thanks so much, Jeff, and thank you to everyone who joined us today from the media and the public via Facebook Live. As a reminder, you can follow our work on our blog, publichealthinsider.com, and follow us on Facebook